This is a 30-year-old female who sustained this fresh injury after an assault. So they had misagreements and someone was yabadde agezaako omukuba omuggo n'ateekayo omukono kati omuggo ogwo ne gumukuba directly ku mukono n'amenyeka bw'atyo nga bw'olaba mu kifaananyi. So here she had this direct blow on her forearm and sustained those transverse fractures in both the radius and the ulna. So at least as of now, we can all tell which one is the radius and which one is the ulna, in according to which bone is bigger distally or proximally, and which bone is major in which joint, whether the elbow or the wrist. So on our left is the AP view, and then on the right is the lateral view. So the aim of this video today is to just point out one complication of these fractures that happen at the same site or at the same level, especially if their diameter is almost the same where the fracture site or at the level where the fracture site has happened. So what I mean is here we have a radius and the ulna which have gotten fractured at the same level in the forearm. So if you are to appreciate the x-rays very well, in the AP view on your left, you can see how it is only the radius that is displaced medially. Then when you look at the lateral view on your right, you will see how this undulation in the radius is pronounced. The ulna looks to be almost non-displaced. That is according to the X-ray. So the gist of today's video is to talk about a possibility of a cross union. I think some of us have heard of a cross union, which is sometimes also called a form of a malunion, because malunion is when you have alignment that is not anatomically correct. So here in a cross union, you are having one fracture fragment like crossing its lane to attach to another fragment which is not supposed to attach to. So what I mean, this fracture, we are having a radius and the ulna fracturing at the same level, and we know that in the mid-third, the radius and the ulna almost have the same circumference, and the fractures happen at the same level. So chances are high that, let's say when you're reducing to correct this undulation, or when someone somewhere in the village there is massaging and doing their chemistry, chances are high that this fragment can attach to the other fragment in the other lane and you get a cross union. So let's say a proximal fragment of the ulna attaches to the distal of the radius, and the distal of the radius or a distal of the ulna, and vice versa. That's what I mean by a cross union. So that is a possibility of a fracture happening, a fracture in two bones at the same level happening, especially when you have the same circumference or the same size of the bones where the fracture site has happened. This can as well happen in the tibia, though in the tibia and the fibula they have different circumferences and size, but it can also happen. It usually happens in parallel bones. And then this calls for vigilance. Whenever you see such a fracture, you shouldn't just look at it per se, but this patient has to understand what they are going to undertake so that they know the repercussions if at all they happen to mess up. Because this cross union will come with loss of the other function of supination and pronation, because when you supination ng'omukono ogutunuza waggulu ng'ogukomyawo, waliwo engeri amagumba ago. There is a way those bones are supposed to slide over each other, or they're supposed to cross over each other. But when they cross and they be rigid, that function will be lost. So here's the pic trying to illustrate what can happen. You can appreciate how that bunch of colors has collected between the two bones, that the radius and the ulna. And I think these bones were being massaged, and that's why these colors happen to spread up to that extent. So these two colors can bridge the two bones and they be rigid, so they can't slide over each other at one time, especially when you're trying to spinate and pronate. So ideally, this injury would require these bones to sit on a plate with screws so that you separate them there and then in an ideal world. But sometimes, you know, we can't afford these procedures. So someone can carefully put their cast and mold it to make sure that these bones are separated. And if the patient is cooperative, yeah, good results can come out. But sometimes you put it and you instruct this patient to adhere to the instructions and they mess up. Then they come back with complications. Then you need to refresh the injuries. You know, it's quite a hectic work and costly. So it calls for vigilance so that you avoid such complications. Thank you.